everyone, this is Sydney wishing you a happy Med-Surg Nurses Week.
Hi everyone, this is Laura. I just want to wish everybody a happy Med-Surg Nurses Week.
Hi everyone, it's Mary Tess and wishing everybody happy Med-Surg Nurses Week.
Hey, this is Sam. Just wanted to wish everybody a happy Med-Surg Nurses Week, and I hope you're able to celebrate with your teams for being part of the best specialty in nursing.
Happy Med-Surg Nurses Week. No. We need some timing.
Happy Med-Surg Nurses Week.
Have you ever dreamed of joining us as a co-host of Med-Surg Moments? If so, that dream might just be one step closer to becoming a reality.
Soon, AMSN will be initiating a nationwide search for 2 new co-hosts to join our Med-Surg Moments team.
Wait, don't they need a whole bunch of podcast experience like us?
Eric, they'll need exactly as much experience as we had when we started, which was 0. So if you're listening, don't worry. No podcast experience is required. Just a passion for Med-Surg nursing and an AMSN membership.
Keep a close eye on your email in early November, as AMSN will be sending out a co-host survey application to all AMSN members. Complete the application by the deadline to take the first step in the co-host selection process.
The email and survey application will also include everything you need to know about the time commitment and the volunteer term. So keep an eye on that inbox in early November, and good luck. On this episode of Med-Surg Moments,
Linda Brown is not just any nurse. She's a medical surgical board certified registered nurse with over 40 years experience. That's 4 decades.
I am from Mobile, Alabama, born in Pritchard, which is like the outskirts of Mobile. I always wanted to be a nurse from childhood. I didn't grow up around nurses. There were no nurses in my family. I never knew what the passion was. It was just like I was destined to take
it. This is Eric.
Mary Tess.
Sydney, Sam,
Neo,
and Laura. Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
During the tough days and long shifts, it's sometimes difficult to maintain perspective as to why we embrace the specialty of Med-Surg nursing in the first place. If you're struggling or simply looking for a little boost of nursing wisdom and inspiration, this episode is for you.
Today, we are truly honored to sit down with a true Med-Surg nursing hero whose dedication and compassion has left a profound impact on both her patients and the Med-Surg nursing community. Linda Brown is not just any nurse. She's a medical surgical board certified registered nurse with over 40 years experience. That's 4 decades of hands-on experience in the hospital setting.
Her excellence in patient-centered care has earned her prestigious recognition, including 4 Daisy Awards and the title of Medical Surgical Nurse of the Year from the March of Dimes. Recently, Linda was also celebrated by the AJC as one of their nurse honorees, further affirming the significance of her work.
Throughout her journey, Linda's hallmark has been a deep-rooted passion for caring and making a meaningful difference in the lives of her patients. But as she'll share with us today, maintaining such high standard of care over the decades requires something equally vital: the art of balancing self-care.
In this conversation, we'll explore her inspiring journey, the challenges she's faced, and the lessons she's learned about longevity in nursing. Linda, it's truly an honor to welcome you to Med-Surg Moments.
Oh, thank you everyone for inviting me. I feel like I'm at an Oscar or something talking about Med-Surg nursing. But thank you all for having me. I always think that Med-Surg nursing is like one of those nursing careers that no one wants to be a part of. But let me tell you, it has enhanced my journey in life, and it's made me a better person doing it. So thank you all again for having me. I hope I don't disappoint, and let's have a great conversation.
I don't think there's any chance of you disappointing us, Linda.
Thank you.
But before we dive into the conversation, our listeners would love to go back in time more than 4 decades ago to hear your personal story.
I am from Mobile, Alabama, born in Pritchard, which is like the outskirts of Mobile. I'm from a family of 9 children. Fortunately, I'm the middle child. So I had the advantage of learning from my older siblings and practicing on my younger siblings to figure out what was the best approach to doing anything. I always wanted to be a nurse from childhood. I never knew what the passion was. It was just like I was destined to take care of sick people. I didn't grow up around nurses. There were no nurses in my family, but I had this lovely mother who was such a caring and compassionate soul. And she always taught us to be kind and to be grateful and always to help others. So for me, my mother was my role model for nursing. And everything that I learned from her is what I do in my career today. So I hope I make her proud. So I'm just truly grateful that my passion was already predestined for me. I didn't have any hard career choices to make. I just had to do the work. And I relished the moment that I knew that I wanted to be a nurse, and I know I still want to do nursing.
You don't get those accolades without that passion.
It's made me a better person. As a middle child, I've always been noisy because I wanted to be heard. And so for me, on my job as a nurse, I feel the enthusiasm of taking care of others. You know, when you're sick, the last thing you need is someone to pity you. So I'm empathetic, but my main purpose is to ensure them that the journey from being ill to recovery will be an experience for me that they'll never forget, and that they'll cherish that experience for the rest of their life.
It's important for us to also talk about the struggles. What have been some of the toughest days as a Med-Surg nurse, and how did you get through them?
I have never struggled with taking care of patients. It's been like a joy. It's a connection. It's like taking care of your family. And so I see my patients as my mother, and I'm going to give them my all. I'm going to make that experience something that will make them relax, make it relatable, and make it so that they can feel as if they can do well and go home. The main struggles I've ever had in nursing, you're not going to believe this, is technology. Everything is now computerized. I just couldn't get it. And that was my main struggle. But now I embrace the computer because it really has enhanced our journey as nursing, and it makes patient care so much better. My really major struggle with nursing was the changing of the uniforms. White uniforms, white shoes. The nursing cap was our signature, our nursing pins. And then to go to multicolored scrubs. I protested. And I protested for a long time, but I didn't win. I was the last person to leave the white uniforms and go into scrubs. I want you to know that. I felt like we lost our identity when we lost our white uniforms. So patients had to try to figure out who the nurses were. Everybody was wearing scrubs. None were uniform. And so everybody was wearing different colors, different patterns. And so patients were confused. So I felt like it hindered our role as professionals in the workplace. But now that we do have standardized uniforms and we're wearing the same colors, I think it makes a difference. But I still have to spruce mine up a little bit to show my personality and the way I dress at work. So my struggles are technology, but I embrace it, and the changing of the uniform. But otherwise, nursing has been such a joy for me. When you have been given the privilege and the honor to take care of a person's personal issues, talking with them through a crisis, and to have them to have a laughing moment during the day, it's like one of the most outstanding feelings you can have as a person, to be able to make a difference in a person's life, even if it's just combing their hair, or brushing their teeth, soaking their feet, trimming their nails, or I call it a spa treatment, giving the man a shave. Those are all a part of why we recover well. When we perform small acts of kindness in the course of our day, it makes you feel better as a human being and makes our patients feel so well too. And so for me, nursing has never been a challenge. It's the staffing. It's all the outside noises that nurses have to continue with in a day of their work. But taking care of patients is one of the joys of my life.
You brought up a lot of really good points. I love what you said about that. Those tiny little things are what make patients feel like a human. It makes them feel less like a number, like a body in a bed. It makes them feel like a person. It makes them feel valued when you do those little things for them.
In the course of a day, if I can find out one little thing that will enhance that person's day, it makes a world of difference to them. And family responds well. I treat family as if they're patients sometimes too. They're part of the care process, and we have to include them in everything that we do. It's a patient-family-centered environment, and I'm the cheerleader. And I was a cheerleader in high school too anyway.
I'm sure that comes through. Your personality is out there like that. I love it. Over 40 years, have you seen things that have changed for the better?
I'll tell you, the best thing that's changed for nursing is a rapid response team. We used to have to use a paging system, and the doctors would have beepers, and we would have to wait until they call back. So now in emergencies, we have a care team that is there right away at the patient's bedside to assist in the recovery of their care. So that is one of the things I really appreciate about technology and the advances in nursing. Also, all the evidence-based procedures that we're doing now. We're dealing with quality matrix. We want to make sure that patients don't get infections while they're in the hospital. So hand washing is essential. Patients are having central lines to make sure that we monitor those daily, and if they can come out, take them out. Patients with Foley catheters, even the Omnicell with medication dispensing, and making sure that we avoid so many patient care errors. So I'm really happy with technology. I just don't like change.
She just did a rose and thorn about technology.
That's right. I don't like change, but I know it's for the best, and it really has enhanced my career as a nurse also.
But I also like how you're embracing it. You have the struggles, but I can feel the joy in your voice, putting yourself out there that I have to embrace the change. And you're saying that this would be helping you as a nurse. I like how you share that story because that's true. There's really nothing that we can do. We cannot control change.
And change is good. The things that I protest the most are the things that I find so helpful in my daily activities. So I tell young nurses now, embrace change. Give it a chance because there's someone out there researching and finding evidence that's been proven effective and it actually works.
It does, but we also have to remember to tell them to question things. There's a little piece of me in the back of my head that always says, trust but verify. So I'm going to give it a shot. I'm going to trust that somebody knows what they're doing. So I'm going to give it a shot, but I'm not going to be afraid to tell you what I really think.
Always question. If it doesn't work, say something. I always say that if something's not working, say it out loud.
Yes.
We have nurses a part of all the committees, so nurses who are at the bedside get an opportunity to share what works and what doesn't work.
We want every nurse to feel that way, to feel that power.
Exactly. And I have to tell you, I keep going back to the old days, back in the 80s, when nurses didn't have a voice. And so we just had to go along with what was said. We carried the physician's chart and we just walked into the rooms with them and we said nothing. But now doctors embrace nursing's opinion and we're part of the care process. We're a part of the team. And that gives us power to make decisions about our patients' care. And I think that's one of the best changes we could have had.
Listening to Linda, it's like I'm imagining history. It's so important for us to honor the history that we have because to your point, all of these things need to happen for us to have a voice, to be able to speak up. Because before, nurses are like, okay, let's follow what the doctors are saying. But nurses like you who are able to see that and being able to speak up, we need to change right now. It's very important for us who are listening right now and listening to your story.
It's important for nurses to grow with society too. We have new generations of nursing. Thinking process is different. I call myself the old dinosaur of nursing on my unit, but I'm full of wisdom and I tell them the things that we're doing now, we did them back then. The basic aspect of nursing and nursing care and nursing procedures hasn't changed, but the safety aspect of doing it better and keeping our patients safe is so much better. We didn't wear gloves back in those days.
Wow.
Who would think that?
Yeah.
So I heard that story, and during the pandemic, somebody told me they used to sterilize syringes. They used to boil syringes because they didn't had syringes before, or no gloves when putting your IVs on. And I'm like, that's where quality improvement starts. I'm really amazed right now. I'm like having a Back to the Future kind of a moment.
Yeah. Needle sticks were rampant. You know, you got stuck with a needle, you were stuck with a needle. But now we have all these safeguards on needles and sharp items. Unless you just are careless and don't follow the rules, you won't get stuck. So there are so many safe barriers for nurses to protect themselves. It's wonderful.
Nursing is changing all the time. I mean, I have not been a nurse for 40 years, but I'm coming up on 20. I was teaching a skills section the other day, and I was talking about doing trach care. And the inner cannulas on the trachs are disposable now. They're single patient use. But the kits that we use still have the things that we used to clean them with. We used to have to reuse those. So we would put them in a sterile tray and brush them out and clean them out and then put them right back in the patient. And those supplies are still in that kit. I was able to tell them that story of why we have those things in there.
And I asked the same question too. We're using disposable intercannula. Why are we using that? I can go back to HIV when it was first diagnosed, and we had the Ebola and then COVID. Yeah, I've seen it all, but I always had faith in science. And I knew that I couldn't abandon patients because I was fearful. So I was educated. Our hospital educated us, and they provided us with all the PPEs and all the tools that we needed to protect ourselves as well as our patients, because a lot of nurses were leaving nursing because of all these infections. So I'm happy that I didn't abandon, and I'm happy that my family was safe and I stayed safe. But you have to be true to the cause.
We're happy you hung around too.
I am too.
I'm a big believer in self-care. The topic has been a recurring theme throughout our 137 episodes. Talk about your experiences in the art of self-care as a nurse.
When I was a young nurse, my first 10 to 12 years, I became what we call today as burnout. I didn't know where my barriers were with nursing. I was like nursing 24/7. Eventually, it will take its emotional toll on you. I got to the point where I understood that I actually had to take care of me. I found that self-care was all about just me, not my husband, not my friends. It was all about me. And I became selfish with my self-care. When you take care of patients and all the emotions that are involved and all of the conversation and the dynamic of the families, it can actually take a mental toll on you because you want to fix everything. That's what nurses want to do. We want to fix everything, and we can't. So we have to figure out exactly what is reasonable within the scope of our care. I can no longer take patients' clothes home and wash them in my washing machine. I can no longer follow patients when they come home and make sure they're okay. And that's the way I kept my sanity. I started traveling more. I started working out with trainers. I started meditating. I did yoga. I walked with my dog. And I just had to find a peaceful place for me to understand what my passion was and what my role was in that passion. You can be the best clinician in the world, and you can deliver this outstanding nursing care where patients want to see you every day. But if you don't take care of you, you have nothing to give to anybody. Back in the day, there was no such thing about self-care. You know, you're a nurse, you have no time for you. But now, with all the evidence out there, our hospital system offers so many things for nurses now. We have to allow time for us to take care of ourselves. Self-care, it works.
It can. It's very easy to fall into that trap. I think we all have stories about that. I can remember talking about my years as a manager and how much I gave to my unit, to the point where I was even answering calls in the middle of the night. My husband, we would be out on a date. We were trying to take time for ourselves, and phone calls would come in. He finally one day just took the phone away from me and said, "They're going to survive without you for a couple of hours. Would you please eat your dinner?" I didn't know how to let go, how to connect, how to set healthy boundaries. And it took a toll on me, not only mentally, but physically too. So it is important.
And guess what? It survives without you. There's a group of people there to do the same thing that you do. We got to let others be accountable and be held responsible to do those things that are pertinent in our role as nurses.
Yeah, I agree with that. You really need to detach yourself at some point. You have to trust your team. You have to trust that your team will take care of your patients while you're not there, and that you need to have time for yourself. Because if you're healthy, your patients are healthy. Your team is healthy. You care for yourself, you care for others. And that is kind of like a domino effect of everything that's happening. It's true. You really need to have that boundary, detach yourself, because to your point, the world will go around and around.
Around without you. It will. Yeah. It will. And I tell you, I'm 43 years into nursing, and I still enjoy coming to work. And I love what I do, and I want to give it back. And I want to show nurses and mentor our younger nurses that once you find your passion in nursing, and once you find the area in nursing that makes a difference for your soul, it becomes the easiest thing in the world to do. There are so many opportunities in nursing for nurses to find that niche for them. They just need to be adventurous sometime and go out on a limb and say, I want to try this. Try different areas of nursing to see what you like. When I first came out of nursing school, labor and delivery and a mother-baby was the thing that all nurses wanted to do. And so that was where I wanted to be. But unfortunately, those nurses never left. They enjoyed it so much, so I ended up in Med-Surg. I never thought that I would be a Med-Surg nurse. And once I got there, it was like, wow, this is where I need to be. We never know where our journey's going to lead us. You just have to be open to trying different things.
Do you have anything to say or any words of wisdom to nurses out there that look at Med-Surg as not a specialty or like a place where maybe they don't see themselves sticking around?
Oh my goodness, you should come to my unit. I'm on a complex medicine unit. It is challenging, but so fulfilling. And if you don't start at Med-Surg and you want to venture out in other areas of nursing, you're at a loss. Because there are so many disease processes and so many things that you haven't seen or you'll never think that you'll see again that you can learn. If there's ever a place to come, is Med-Surg. I never thought I would be in Med-Surg for 43 years.
When I graduated, I knew I wanted to start on Med-Surg. That was kind of how I put it in my head, exactly for the reasons that you said, because I thought this is where I want to start. This is my foundation.
Right.
But I ended up feeling so at home. I loved the kind of care I could provide to nurses on a Med-Surg unit. I ended up not leaving for a very long time.
Oh, I love it. We know that there's crisis in staffing. You work as a team. You get to meet the patients and their families because our patients are awake. We get to hear their stories. It's like a family on Med-Surg for me.
What do you think Med-Surg nurses can do right now to help new nurses transition? Because nursing school is different now than it was even a few years ago.
The major thing that they need to learn is how to relate to patients. And I find that a lot of our younger nurses, when they come in, they're really afraid to communicate with our patients. And so taking them into the room and just showing them how easy it is to talk to patients. It starts with a simple good morning. How are you? By their name. How did you sleep last night? What is the one thing that I can do to make you happy today? You tell them about the plan. So we have to take them under our wings. We don't give them the most difficult patients. You give them patients that are not as challenging, but they can feel success from it. And we go with them each and every time they go to a patient's room. So if they have questions or if they're nervous about something, you're there to hold their hands and get them through it. So they just need guidance and they need compassion. And they need our understanding and not to be judgmental.
Can you share a story that really made you realize this is the real joy of nursing?
So we had a patient on our unit, had a trach, had a feeding tube, every tube that you can imagine he had. He didn't speak English. And so we had communication barrier. And he had a dialect that our interpreters really couldn't pinpoint. It was touchy, but we worked with him. Kindness is universal. People and patients can feel your spirit of caring. It's not what you say, it's what you do. Our patient couldn't move, he couldn't feed himself, he was incontinent, and our team worked with him 24/7 to get him to a point where he started teaching us Spanish. He was so engaged with our team until he was back to the point where he could feed himself. It was a struggle, but we worked with him every day. He was able to get in the wheelchair and walk around our nurses station. He started calling us by our names. So I don't care what state a patient is in, kindness is essential. Kindness is paramount to everything that we do. If you bring that into a patient's room each and every day, you're already winning because it's felt by the patients. They embrace the challenge of getting well, and they trust everything that you tell them to do. That's the most satisfying feeling you could ever have.
It's really warming my heart. I'm just listening and my heart is like so full. It's the universal language. It's touching a patient's hand. It's kindness, caring. We know that, but hearing it from you, hearing it from our peers, you have to do that every day.
It's all about the patient care experience for me. Nothing less, nothing more. It's all about that. And it's always going above and beyond.
I'm going to take that with me.
Yep, I have so many notes here.
It's a gift to be able to enhance someone's life. It's just so remarkable for me. And I'm just so honored and blessed that I grew up in an environment at home where my mother was nice and kind. And can I say all of my siblings are nice and kind people?
Yeah, that's the blessing. That's the gift. And I go back to what I shared a while ago. It's the environment you're in that makes who you are. And you're sharing that to the world right now.
Oh my goodness, I thought I was just talking to you guys.
Nope, this is going out to all of our listeners. I love that. I feel like we need multiple episodes just like this to keep talking to you, Linda. Thanks so much for joining us. But unfortunately, we've run out of time. It's truly been an inspiration having you with us on this episode of Med-Surg Moments.
Oh, thank you. The pleasure was mine.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag Med-Surg Moments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Laura,
Mary Tess,
Neo,
Sam,
And Sydney. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.